Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Pediatric Evaluation of Disability Inventory assesses functional capabilities and performance in children with disabilities. It evaluates self-care, mobility, and social function in pediatric patients. The main purpose is to measure a child's ability to perform activities of daily living and identify limitations related to developmental delays, cerebral palsy, spina bifida, and other neuromuscular or musculoskeletal conditions. The tool aids clinicians in planning treatment, monitoring progress, and determining the need for therapeutic interventions. It provides standardized scores that assist in comparing functional status across different populations and time points. The Pediatric Evaluation of Disability Inventory is indicated for children from 6 months to 7 years of age with a variety of developmental, neurological, orthopedic, or acquired disabilities. It is most useful in clinical settings requiring comprehensive assessment of functional abilities in self-care, mobility, and social function. The instrument aids in evaluating baseline functional status, monitoring progress over time, and guiding intervention planning. It is particularly relevant for populations with cerebral palsy, developmental delays, acquired brain injuries, and musculoskeletal disorders. Its standardized format and focus on capability versus capacity support its application in both rehabilitation and early intervention programs. The Pediatric Evaluation of Disability Inventory is administered by first selecting the appropriate domain for assessment: self-care, mobility, or social function. The inventory contains 225 items divided across these 3 domains. Each item assesses specific functional skills through a questionnaire format. Caregivers or clinicians respond to each item using a 3-point scale indicating whether the child is capable of performing the task, partly capable, or unable to perform it. There is also a caregiver assistance scale that measures the level of help required, using a 5-point rating from total assistance to complete independence. After scoring, raw scores are converted into scaled scores. These scaled scores are compared against age-specific normative data derived from a representative sample. Scores falling below the 10th percentile suggest significant delays or disabilities in functional performance. Scores between the 10th and 25th percentiles may indicate mild to moderate delays, whereas scores above the 25th percentile reflect skill performance within normal limits. Clinicians interpret the results by examining domain-specific scores and overall functional capabilities to guide intervention planning. The sensitivity of the Pediatric Evaluation of Disability Inventory refers to its ability to correctly identify children who have functional disabilities. Specificity reflects its capacity to correctly recognize children who do not have such disabilities. Studies evaluating the Pediatric Evaluation of Disability Inventory have reported sensitivity values ranging from 0.8 to 0.9, indicating that the tool accurately detects 80 to 90% of true cases with functional limitations. Specificity values have been documented between 0.7 to 0.9, showing that the instrument correctly excludes 70 to 90% of children without disabilities. For example, in a clinical setting, a sensitivity of 0.9 means that out of 100 children with a disability, 90 will be accurately identified by the Pediatric Evaluation of Disability Inventory. Conversely, a specificity of 0.8 implies that out of 100 children without disability, 80 will be correctly classified as not having a disability. These metrics support the reliability of the Pediatric Evaluation of Disability Inventory in distinguishing between affected and non-affected pediatric populations. The Pediatric Evaluation of Disability Inventory was developed in the early 1990s by Haley and colleagues to provide a standardized measure of functional capabilities and performance in children with disabilities aged 6 months to 7.5 years. Initial validation studies demonstrated strong content validity through expert panel reviews and extensive item analysis. Subsequent research established high test-retest reliability with coefficients ranging from 0.85 to 0.95 across domains of self-care, mobility, and social function. Construct validity was supported by significant correlations with established measures of motor function and developmental milestones. Criterion-related validity was further confirmed by the instrument's sensitivity to changes following therapeutic interventions in various pediatric populations, including cerebral palsy and developmental delay. Cross-cultural adaptations and translations have undergone rigorous psychometric evaluations, consistently yielding reliability and validity indices comparable to the original version, thereby reinforcing the robustness of the Pediatric Evaluation of Disability Inventory as a comprehensive assessment tool in pediatric rehabilitation settings.
Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.